Hey everyone, I'm Casey Funderburg and I'm joined with former Lady Vol, Dr. Sarah Edwards, and I want to thank you for taking your time to speak with me today. You grew up in a small town, Gatlinburg, Tennessee, and you were able to go and play for the University of Tennessee and be a Lady Vol. So what was that like?
Oh, it was a dream come true. The ultimate goal that I had growing up was to be able to play for Pat Summit, being able to stay close to home. Sevier County is a very, very good girls basketball town, I would say. So I feel like I got to make some people proud, and it was wonderful to get to go to all the Lady Vol camps growing up. I went to all of those.
And you got to play with some Lady Vol greats, even now head coach Kelly Harper. So what was that like?
It's hard to mention all of the greats that I played with. We probably don't have time. But I mean, especially talking Kelly, my biggest memory is Kelly. I think the most important thing, the thing that stands out, 20 years later from my experience is that she is a class act person. When I came in, she was a senior. I was a freshman. She was one of the leaders on our team. No one worked harder than Kelly in the classroom and on the floor. She had the best manners, and she also included us. I remember as a freshman, I didn't know if I'd be an outsider or whatever. She would never make you feel like an outsider. Kelly is a good person at heart, and it shows. I mean, it still shows. Obviously, she's a great basketball player, but from a standpoint of who she is, she's a really good person who works hard, who understands the values, and understands how to get what she wants.
And how much does that mean to you off the floor, knowing that, you had a teammate and now you still have a friend who, is such a great person outside of the sport?
I think that's the thing that always amazes me, because a lot of the girls I played with were phenomenal basketball players. But what I've really been impressed with is how much they've done in their life after basketball. And yes, you can credit it to a lot of the lessons we learned as Lady Vols, I think. But it's amazing all the things that my teammates, from Kelly to Tamika, Shamiqua, Kara Lawson, I mean, all these girls have done big, wonderful things. And so I don't know if it's that they know when they're recruiting, they want the whole package when they're recruiting, because they do. They pick smart women who are very driven, who are amazing basketball players. But these women have really become amazing things in their lives.
You also got to play for Pat Summit, obviously. So what was that like, being able to play for her?
People always ask me, well, how was that experience? It was the hardest thing I've ever done. I mean, like, that's the truth. It was so, she was a very demanding person, and she expected a lot out of you, but it was also the best thing I've ever done. So one thing that she would say to us, and it, I still hear her saying it, and I say it to myself sometimes, is nothing worthwhile is easy. And I think I learned that there. Like, anything that is worth a lot to you in your life that you look back on and you're like, this is very important to me, it wasn't easy to get it. It was not handed to you.
Are there any characteristics that you learned from her that you are using today, especially with being an ER doctor?
Yeah, there's a lot of things that I think I've taken forth, really, even just going from the University of Tennessee, and then I went to medical school. And I remember medical school is a really hard time for people academically. But after learning the discipline that I learned at the University of Tennessee, med school was not easy, because it's never easy. But I didn't have to concentrate on the disciplining myself part, because I had been doing that for 4 years being a Lady Vol. I definitely understood the value of hard work, because that was instilled upon us at the University of Tennessee by Pat. And I 100% knew that if this was important to me, that I was going to have to work at it every day, all day. And that was really important to me. So I think she made me be able to handle med school well, because I knew how to self-discipline myself, because I learned it from her. I also learned that the amount of focus that you have to be a good doctor, especially in the emergency room now, I credit her for that, because she was very big on saying that there was never to be one play wasted. If in practice, if you were in your third hour and you were tired and you just kind of went through the motions, she would blow the whistle right there and stop it. Say, no, we're not doing this. We have to give it everything we have, every bit of focus, our entire practice, every play. It doesn't matter if you're tired. And that's something that in the ER, I have to do that with every patient, no matter what time it is, no matter if I'm working overnights, no matter if I've just walked out of a room where something bad happened. I have to come out and be composed and focus on the next patient.
With everything going on right now with the coronavirus, I mean, you are directly involved with a lot of that, being an ER doctor. So what has that been like for you?
It truly is a privilege for me to take care of people. And I don't take that lightly. I'm proud of that role. But it's also sometimes anxiety provoking because I'm trying to keep myself safe. I'm trying to keep my kids here at home safe. I don't want to bring anything home to them. Other times it's just mentally taxing because right now we have to really be careful with all the information that's coming out about this disease because it's coming out so quickly and things are changing that we have to spend a lot of time studying it. So it's been a mixed bag. There's been some really positive things from it in healthcare, I think. It's been beautiful to see the appreciation that the American public has shown healthcare providers, including doctors, nurses, our clerical staff, our environmental services.
What are some of those steps that you have to take when you are leaving the hospital and have to come home so that way you don't infect your 4 little girls or your husband or anyone else that you might be around?
The most important thing is while I'm there, I have to be really careful with putting on and off my equipment after I go into a room with someone with the coronavirus. I have to be very careful. When it's time to go home, you change everything. You take all that off and you have to even take your clothes off and change your scrubs into clean scrubs. And then you kind of start the drive home and I feel like I'm taking Clorox wipes. I'm wiping everything in my car. I'm wiping my steering wheel. I have all kinds of hand sanitizer. I take my shoes off outside. I take everything off outside and I run in the house hoping nobody sees me. I get straight into the shower. And so it's this decontamination that you go through while you're still at the hospital and it continues to when you get home because you don't want to bring really anything in your house right now that has been in the hospital.
Are you just specifically seeing a lot of COVID-19 patients, or are you still having to go, handle someone who has something completely different? How are you going about doing all of that?
So that's a great question. And right now, and it changes almost every day, this is a very fluid thing because things are changing so quickly with it. A lot of people don't want to come to the ER right now because they're afraid they're going to be infected. So our numbers, I'm not quite as busy as I used to be, but I'm seeing mostly either people with COVID or people who are rule out COVID, meaning they're there for the test, or I'm seeing people with true emergencies that they have to be at the ER no matter what.
When you're talking about changing how things can change, daily, hourly, even, when you think about that in terms of basketball, when you're in a game, a situation can change so quickly and you have to be prepared. So do you ever use kind of that basketball mindset with everything that's moving so quickly with this virus?
Yes. So the amount of metaphors you can make between sports and medicine, there's so many. There's just so many. And so, for me right now in the ER, I'd say maybe the most important one is being part of a team. And I can't even stress, in the ER especially, a patient's life hangs on how well you can interact with your nurses and your consultants. And if we all come together and work as a team, we are so much better. We are so much better. And that's probably the most important one, honestly, right now, especially in these stressful situations, is the ability to work as a team.
If Pat Summitt were still here today, what do you think she would tell you right now, knowing that you are in the front lines battling this?
It's funny. I could see her calling me and maybe asking me everything about the illness so she could be prepared because she was always prepared. Then I can also see her telling me, good job. She was not one to never give compliments. She gave compliments, but she only gave them when they were really due. So I can see her just telling me something easy like, good job. I'm proud that you're taking care of us. I could see her saying that.
Dr. Edwards, I just want to thank you again for taking time to speak with me today. And I loved hearing everything you had to say about Pat and your team. And just thank you for all that you're doing in North Carolina and, working with everyone to fight this virus.
Thank you so much. I really appreciate it.